Good morning. Nice to see somebody is tuned in, and I see a few other people are coming on. Today is May the 8th, 2020, and the reason for this broadcast is to go over the changes that were made to the Canadian Pediatric Society statements, or practice points, that is, on May the 6th. If you haven't seen the practice points to this point, I will put the link in the comments section for viewing after this is done. There's 3 documents, and they're available at www.cps.ca. And those 3 documents cover 3 different but important topics. The first is NICU care for infants born to mothers with suspected or proven COVID-19. The second is breastfeeding when mothers have suspected or proven COVID-19. And the last is delivery room considerations for infants born to mothers with suspected or proven COVID-19. And so the purpose of this was, rather than having people have to go and read all 3 documents all over again, I thought I would draw everyone's attention to what are the differences from the original practice points and give you a bit of an idea as to why we've changed the recommendations. So I'm going to start with NICU care for infants born to mothers with suspected or proven COVID-19. The big change that you'll find in that statement is that we are still recommending transport within the hospital in an open isolette if a patient is not symptomatic. And in a closed isolette, of course, if they are symptomatic. But when it comes to transport, there's a difference there. And the difference is that we had been recommending previously that a baby who was less than 24 hours of age did not require PPE that included an N95 mask. And the argument there had been that the earliest reported cases were at 36 hours of age. The realization that we now have cases in the literature, at least one case that was reported at 16 hours of age that I'll get into in a bit, necessitated a reconsidering of the early or the time point at 24 hours. Given that people are working in a closed, confined environment, it made sense to suggest that when you're going to retrieve an infant who is born to a mother who is COVID suspect or COVID positive, we would use N95s from that early stage. The second document that received quite a bit of attention actually was breastfeeding when mothers have suspected or proven COVID-19. The issue that people took with that document was the notion that mothers should wash their chest with soap and water before every breastfeed attempt. This did raise some concerns. We received at the CPS some statements or emails from people who were wondering where this came from. Interestingly, the rationale had been that given that we know that people are now wearing masks, and when they wear masks, or even without wearing masks, they tend to touch their face a lot. The concern was when they're handling their breast, they could also contaminate the breast potentially with coronavirus. And so that's where the idea came from. I noticed in the past week that it was either the WHO or the CDC recommended that if a woman has recently coughed and was not wearing a mask, that she clean her chest with soap and water before putting the baby on the breast. And that is essentially the direction that we've gone now, is to say that not every single time does a woman have to clean her chest with soap and water, but if she has been coughing recently and she's not been wearing a mask, then it would be out of an abundance of caution that we would recommend that she cover with a mask and then clean with soap and water prior to putting her baby on the breast. So that is the main change in that document. And then the final document where I would say, the most significant changes are the delivery room considerations for infants born to mothers with suspected or proven COVID-19. So I mentioned before that there was a case report that came out of an infant who was born to a mother who was COVID positive, and at 16 hours of age, the baby tested positive for COVID-19. Um, this became the earliest, and to my knowledge is still the earliest reported case of a baby who was tested positive. Now, curiously, the baby in this situation never did come to test positive in terms of IgM or IgG, either in the hospital or even after discharge at 3 weeks of age, and this was communicated to me by the author of the paper. This does raise into question whether this could have been a contaminant of the baby, but as other case reports continue to come out showing other babies who test positive at 36 hours or 24 hours, it certainly is beginning to raise a question of, is it possible that you could have vertical transmission? The second case to mention, which was motivational in changing our recommendation, was a case out of Iran. And in Iran, there was a case of a mother who underwent a cesarean section who was COVID-19 positive. And the the amniotic fluid was aspirated into a syringe under sterile conditions at the time of the cesarean section once the amniotic fluid cavity, once the uterus had been opened. The fluid did test positive for COVID-19 and is the only, to my knowledge, the only case of a positive amniotic fluid. The baby, interestingly, tested negative on nasopharyngeal aspirate, although 24 hours later did test positive. So again, questions surrounding the evidence that this is vertical transmission versus horizontal transmission or false positives. But nonetheless, they are two concerning cases. Now, what do both of these cases have in common? And that is what informs the practice point. What both of them have in common is in both cases, the mothers were extremely ill. The mother in the case of the positive amniotic fluid passed away. Given that these occurred in mothers, these suspected cases of vertical transmission occurred in mothers who were very, very ill. What we have done in the practice point is we've modified the recommendations for PPE at delivery to be based around the symptomatology of the mother. And so what we have said is, in the symptomatic mother, which is any one or combination of tachypnea, cough, respiratory distress, or radiography consistent with a lower respiratory tract infection, with or without fever prior to the onset of labor, and whether they are receiving respiratory support or not. In those cases, if you are going to the resuscitation, we are recommending now that you bring an N95 mask for those people that are doing the resuscitation. To be clear, we're not recommending universal use of N95 for all COVID suspect or COVID positive mothers, but in the ones who are symptomatic, the theory is, and at this point is just a theory, is that those mothers with a higher viral load may be the ones who are more symptomatic. And so the very, very symptomatic mothers with the high viral loads are the ones that we are concerned about that they may transmit to the newborn, or rather to the fetus. So I would like to just reiterate that overall, there are now about 250 women and their pregnancy outcomes known in the literature. There are very, very few cases that have been questioned as vertical transmission, although I believe we will see more case reports to come. But with the fact that we do have some of these and with the questions coming up, certainly with our last practice point about also knowing that some places in the country have been going with N95 masks, it was felt that there was a time, or the time was right to sort of find a common ground, if you will. And that common ground is having to do with the symptomatic mother. And so, again, I would encourage you to have a look at the practice points. We are endeavoring to update them as new literature comes out, and they are reviewed once a week. And with that, I'll just open this up quickly to any questions. If people want to type into the comment section, I can answer any questions that may come up. Or if you're content, you can look at the statements and you can post questions afterwards. And as always, I appreciate knowing where people are from, and I see there's quite a few people online right now. So if you Wouldn't mind leaving where you were from. It's nice to know how far this reaches. And certainly if you felt that this was worthwhile and you think that other people would benefit from this information, feel free to like and or share this broadcast. I think it's important that people are aware that changes have happened to our recommendations, and hopefully they will inform practice around the country. So with that, I will suggest everyone to stay safe, and hopefully this will not last too much longer and we can go back about our lives before too long in the future. Take care, everyone.